Hi guys, welcome back to my channel. So today we are gonna talk about mental health and why we the Nagas needs to be aware about the mental health problem. So stay tuned and watch till the end. There are many reasons why we need to solve this mental health problem. But first, if you look into what are the mental health problems, and there are loads of mental health problems, starting to name them few, like schizophrenia, bipolar, antisocial manic, and say anxiety, depression, and suicide feeling, and a lot more. And you know what we Nagas we call to a person with mental health problem are, the first thing we call pagla, or if it's a female we call bagli, and the second thing is demakpia. So it's a very derogatory term. No one wants to be called as pagla, bagli. We get offended, of course, if someone calls me pagli or demakpia. Of course I will be very offended, even though if I have some mental health problem. But you know, it is very important to be aware when you call someone bagla, bagli, because even you won't like it when someone calls you that. And that is the reason why we need the knowledge about mental health. And just because you call them bagla, bagli, you know, people who have mental health problem, they try to hide themselves instead of trying to get help. And you know, the worst feeling is when your neighbor or a friend or relative, they go in search of a psychiatrist or psychology for help, but instead of supporting and encouraging them, the community members or the neighbors, they started gossiping about them. And you know what it says? And that's the worst thing. No one wants that kind of problem in life. But you know, sometimes it comes from a childhood trauma, or maybe the working of neurons in your brains might have some problem, or maybe because of some very tragic accident or incidents in life. So maybe that's the reason they have mental health problem. But we society, we never try to understand, but in fact we try to stigmatize, we discriminate them, and that is the reason why instead of trying to get help, they try to torture themselves more, and they feel like that's the end of the life. See, today in our society, if someone has a mental health problem, okay, the first thing what the parents or the neighbors or the society suggests is take him or her to a prayer center. I don't say it is wrong. Everyone needs prayer center because we need prayer in our life for spiritual growth. But that's not the right place actually to heal a person with mental health problem. They need to take step by step. Just prayer alone cannot help them. You know, for example, if someone is suffering with a cancer, you know, they go to a surgeon, a cancer institute, and not go to a dermatologist, or maybe not go just to a prayer center. I know miracle happens, prayer works, but not for everyone. So you should be very practical, and that's the reason why we need psychiatrists and psychologists. So here I want you to know the difference between a psychiatrist and a psychologist. So in Nagaland, we have a prison, we have hospital, we have church, and we have counselors, we have spiritual counselors. And so far I've noticed that in most of the prison I see a counselor, like spiritual counselor, and of course they are from theological background, and I really appreciate that. But remember that spiritual counseling is different from a psychologist or a psychiatrist. We need very much spiritual counseling as much as we need psychiatrists, because we need spiritual growth. But we should also know that a psychiatrist and psychologist plays a very important part in human life, especially because it deals with our human emotions, our feeling, and our brain. So that is the reason why we need. So it is an hour of need for our Naga society to be well aware of all this. So let me tell you the difference between a psychiatrist and a psychologist. First thing, psychiatrist deals with your brains, and they can prescribe you medicine and they help you with medicine. But a psychologist cannot use medicine. They don't use medicine, but they can always refer you to a psychiatrist. But a psychologist will help you like dealing with your emotions, your feelings, and help you to understand and go with your problem. So there are lots of success story. It's not the end of life, but we are not aware about that, and that's the reason why we struggle ourselves. So today I have invited 3 of my friends. They are very well trained and professional therapists. So right now they are working in Nagaland, but all 3 of them will not be talking today because since it's a very important topic, I want the video to be short enough, and only one of my friends will be talking today. 2 of them will be very soon out with the part 2. So today's topic, she will focus on the needs and importance of a psychotherapist or a psychiatrist in a church settings. So listen to what she says, and I'm pretty sure you will learn a lot.
I'm given an opportunity to speak on the roles and importance of psychologists, psychiatrists, or psychotherapists in the church setting today. First of all, I would like to begin by saying that a surgeon cannot become an architect, or even a dentist cannot become a gynecologist. And I see a lot of role-playing in today's church context, especially among the pastors. You know, the pastors who act as a counselor when he or she is not even specialized in the counseling subject or even in the counseling departments. And I see that, I won't say all, but I'd literally say some, or many I should say. You know, the pastors cannot go on having one-to-one interaction with the people, or one-to-one interaction with the congregation, talking about their mental illness. And that itself is the reason that we need a psychotherapist, a psychiatrist, or a psychologist in the church context today. Having worked in the church setting for around 6 months, you know, and also having visited many churches, I see among the youths and also among the married couples that there are a lot of problems, psychological distress among them. I see a lot of people, especially the youth, they are having this problem called body dysmorphic disorder, or even borderline personality disorder, attention deficit disorder, or even say as in like panic attacks, anxiety, and also a lot of things. If I have to go, it will go on and go on. And not only that, but even among the married couples, you know, there are a lot of domestic violence. And also not only that, but extramarital affairs. When we look into the core issues, they need a proper therapeutic intervention in today's context. And also to some people who are substance used, you know, when they have this kind of withdrawal symptoms, as in like hallucination, when they have this kind of paranoia, schizophrenia, they are often called that they need, what do they need? The people say that they are demon possessed, and that they are sent to the prayer centers directly. In fact, or instead of sending it to the proper therapeutic centers, you know. I was once told that a premarital counseling should be given only by married couple. And I felt so funny inside me, but I didn't share it with anyone. But I'm just sharing today, but no dear, it's not like that. Premarital counseling can be given even by those unmarried people, so never have those kind of assumption in your mind. And I would like to ask something. Do you have panic attacks? Do you have sleepless nights? Do you get kind of like, what should I say, depression? Do you have anxiety problems? Do you have traumas? Or even do you have attachment problems? Do you have, or do you sweat a lot? Do you have a shoulder pain? You have anxiety problems? You need counseling, my dear. Why do a church need a counselor today? A church need a counselor, a psychotherapist, a psychiatrist, or a psychologist today in the church setting today. Why is it? Because you need not go on spending thousands of bucks spent, like looking for other professional counselors. When you have in your own church context, you need not go and confide it to the people, to other people. And as I said before, a pastor or the pastors cannot go on having a one-to-one interaction to all the people, talking about your mental illness who are not even experts or even specialized in the counseling department or the counseling subjects, cannot have this kind of like the deeper conversation with a client in order to give a counseling. Because to have this counseling, you know, you need to have specialized in the counseling subject, so that you can have, or you can go into the deeper core issues of what the person or what the client is suffering from. Well, I hope you find this video clip a very productive one or a helpful one. God bless you all, and thank you, Jan, for giving me this opportunity to speak on the very need of the hour today. Thank you.
Thank you, Niyuti, for your contribution besides all your busy schedules. May God bless you. And if you are wondering, what about the responsible of a family or a responsible of a society or a friend towards helping a person with mental health? Or maybe if I go to a psychiatrist or a psychotherapist, what will I expect? What is their rule? And what is the responsibility towards meeting the needs of a person with mental health problem? Then don't worry, it will be out soon tomorrow, so stay tuned, and don't forget to come back tomorrow. So spread it, let the people know, let our Naga people be aware of it, and let's stop discriminating and stop stigmatizing them, lend our helping hand to them. So thank you so much, and if you like this video, then kindly like, subscribe and share, and I'll see you in the next video. Bye.